Ever wondered if those little changes in your daily routine might be more than just aging? Stay tuned to uncover 7 uncommon early signs of dementia that every senior and their loved ones should know. Sign number 1, subtle memory glitches. Imagine noticing small memory slips that you never used to have. You might find yourself misplacing everyday items like keys or glasses without any clear reason. These are not the typical moments of forgetfulness that come with age. They're subtle glitches that happen more frequently than you expect. Research shows that these minor lapses may be early indicators of cognitive changes that require attention. It is not just about forgetting a name or a face. It is about those everyday moments that slowly become a cause for concern. If you or someone you love starts experiencing these inconsistencies, it is important to pay attention. Think about the times when you struggled to recall a recent conversation or misplaced an item in a familiar spot. Such changes could be a signal that your brain is sending an urgent message that should not be ignored. Sign number 2, unexpected difficulty with daily tasks. Consider a time when a routine task that you once handled effortlessly suddenly becomes a challenge. You might have noticed that following a familiar recipe or paying your bills has become confusing. This is not about occasional errors that anyone might make. It is about a gradual and unsettling decline in your ability to perform daily activities. Studies have shown that when tasks you have always mastered start to feel overwhelming, it might be more than just a sign of aging. Imagine the frustration of not being able to complete a simple task that once gave you a sense of independence and pride. This difficulty is not only practical, but also emotional, as it can shake your confidence. If you experience these challenges regularly, it is important to discuss them with someone who understands and can guide you toward a solution. Sign number 3, changes in social behavior and interests. Think back to a time when you eagerly looked forward to meeting friends or engaging in your favorite hobbies. Now, you may find that these activities no longer hold the same appeal, and you feel a growing urge to isolate yourself. This change in social behavior and interests can be a subtle yet significant sign of early cognitive decline. Trusted health experts have noted that when seniors start withdrawing from activities that once brought joy, it may be a warning sign. The shift from active participation to quiet isolation can feel confusing and lonely. It is important to recognize that this change is not simply a matter of preference, but could be an indication that your brain is struggling to process the social cues it once understood so well. Recognizing these changes early gives you the chance to seek support and maintain your quality of life. Sign number 4, uncharacteristic mood swings and irritability. Imagine waking up one day and feeling emotions that seem out of place. You might experience sudden mood swings or irritability that you never had before. This is not just a bad day or a moment of frustration. It is a recurring pattern that feels alien to your personality. Many trusted sources explain that these uncharacteristic mood changes can be early signs of dementia. When you find yourself unexpectedly angry or unusually down without any clear cause, it might be your brain signaling a deeper issue. Such mood swings can disrupt your relationships and overall well-being. It is crucial to acknowledge these emotional shifts as serious rather than dismissing them as a normal part of getting older. If you notice these changes, take them seriously and consider speaking with a healthcare professional to explore further. Sign number 5, difficulty finding the right words. Picture yourself in a conversation where you struggle to find the perfect word to express your thoughts. This is more than a simple slip of the tongue. It is a noticeable difficulty in communicating clearly. Trusted research in cognitive health tells us that when seniors begin to frequently pause or use vague language, it could be an early sign of dementia. It is not just about occasional stumbles in speech. It is about a persistent struggle that interrupts your flow of thoughts. Such changes can be frustrating and can leave you feeling vulnerable during conversations. When words that once came easily become elusive, it is a red flag that your brain might be sending urgent signals. These early communication challenges should prompt a deeper look into your overall cognitive health, as early action can help maintain the clarity and confidence you value. Sign number 6, confusion over time and place. Imagine finding yourself confused about the day, the date, or even your location, even in places you know well. This confusion over time and place is not a one-off moment, but a repeated experience that disrupts your sense of normalcy. Trusted experts warn that when seniors start to lose track of time or get disoriented in familiar environments, it could be a serious early warning sign of dementia. You might suddenly find yourself unsure of where you are or why you are there, leading to a deep sense of anxiety and frustration. Such moments are not just fleeting lapses. They indicate that your brain is struggling to maintain its normal functions. Recognizing this confusion early and addressing it with a healthcare provider can be critical in managing your overall well-being and ensuring that you receive the support you need. Sign number 7. Changes in visual spatial skills. Imagine having difficulty judging distances or reading maps, tasks you once performed effortlessly. Changes in visual spatial skills are a subtle sign that may go unnoticed until they start interfering with your daily life. Trusted health research indicates that challenges in navigating familiar environments or difficulties in processing visual information can be an early sign of cognitive decline. You may notice that tasks like parking your car or finding your way in a shopping center have become unexpectedly challenging. This loss of visual spatial ability is not merely an inconvenience. It is a sign that your brain's ability to process and interpret the world is changing. Recognizing these difficulties is essential because early intervention can help you adapt your environment and preserve your independence. It is important to take these changes seriously and discuss them with a professional who understands senior health. Let us take a moment to recap the 7 uncommon signs we discussed today. We looked at subtle memory glitches, unexpected difficulty with daily tasks, changes in social behavior and interests, uncharacteristic mood swings and irritability, difficulty finding the right words, confusion over time and place, and changes in visual spatial skills. Each of these signs may start small, but they can grow into serious issues if left unchecked. I urge you to monitor these changes closely and take proactive steps if you notice them in yourself or a loved one. Consult a trusted healthcare provider and consider a comprehensive cognitive assessment. Your health is your most valuable asset, and early detection can empower you to take control of your future. Stay vigilant, stay informed, and above all, take care of yourself and those you love.